Hello everyone. I'm going to start with the second topic of first chapter, that is necrosis. The form of question that have been asked so far, they are: what are the type of necrosis, give three examples of each, and discuss the etiology and morphological features of the caseous necrosis. It has been asked as a 10-mark answer, and other form is tabulate the difference between dry and moist gangrene, that has been asked as a 5-mark answer. So let's start with the topic of the day, that is necrosis. What is necrosis? Necrosis is characterized by denaturation of the cellular proteins, leakage of cellular content through the damaged membranes, local inflammation, and enzymatic digestion of lethally injured cells. What does it mean? It means whenever a cell undergoes an injury or there occurs hypoxia, there will be irreversible injury to the cell that will lead to the denaturation of the cellular proteins. There will be damage to the cell membrane through which the cellular content will leak out of the cell, and that will induce the local inflammation, and it will lead to the enzymatic digestion of the injured cells. How necrosis will morphologically appear to us? There would occur the cytoplasmic changes and nuclear changes, obviously. So, what are the cytoplasmic changes that will happen? Cytoplasmic changes are increased eosinophilia, and there will be increased eosinophilia of the cytoplasm, and that increased eosinophilia is due to denaturation of the cellular proteins and due to loss of the cytoplasmic RNA. These two factors will lead to increased eosinophilia of the cytoplasm. And second is the myelin figure formation. As I told you in the earlier video, that these myelin figures are made up of phospholipids and calcium, but most of the content or the maximum content is the phospholipid. So other nuclear changes that will happen, they are the pycnosis, karyorexis, and karyolysis. I promised you in the earlier video that I will explain these three terms to you. So here is the explanation. What is pycnosis? Pycnosis is nuclear shrinkage and increased basophilia. What is karyorexis? It is more pinkish appearance of the cytoplasm and nucleus get fragmented. And what is karyolysis? That cytoplasm will become intensely pink and nuclear material would disappear only. So how these three nuclear changes will appear to us? So um, this is our normal nucleus. This is the normal nucleus or the normal cell. And how the pycnosis will appear to us? That is, there will be increased eosinophilia of the cytoplasm, and there will be the shrinkage of the nucleus. That is, the nucleus will get there will occur the chromatin clumping of the nucleus, and it will appear small and intensely basophilic to us. Okay. Then what is karyorexis? Karyorexis is there will be increased basophilia, increased eosinophilia of the cytoplasm. That is, cytoplasm will appear more pink to us, and there will be the fragmentation of the nucleus. And how karyolysis will appear to us? In karyolysis, the cytoplasm will become intensely pink. That is, it will appear more pink than the pycnotic changes and the karyorexis changes. The karyolytic changes would be intensely pink, and no fragmented material of the nucleus will be even visible to us. I hope these three terms are clear to you now. So, moving on to the next, what will be the electron microscopic changes of the in necrosis? That there would be the discontinuities in the plasma membrane and the organelle membrane. So, through these discontinuities, the cellular content will leak out into the environment and will induce the local inflammation. There will be the dilatation of mitochondria and large amorphous densities. there will be myelin figure formation, and there will be aggregates of fluffy material representing the denatured proteins. So moving on to the next, what are the types of the necrosis? What are the types of the necrosis? The first type is the coagulative necrosis. So, coagulative necrosis is the most common type of the necrosis, and it happens in all solid organs except the brain and pancreas. I'll explain you further. So, all the solid organs will present with the coagulative necrosis whenever injury happen to them, and how it will present grossly to us, that is the affected area would be yellowish, and that area will shrunken in that will get shrunken in size. And how it will appear to us microscopically, that the architecture of the dead tissue is preserved, that is we will be able to see the ghost cells. And how these things will appear to us, so let's see. See, this is the section of the kidney, and how it will grossly appear to us. See, the affected portion is yellowish in color, and it has shrunken in size. This is how it will appear. The coagulative necrosis will appear to us grossly. And how microscopically it will appear? See, this is the demarcation line. This is the normal side of the kidney, and that is the necrosed or the affected part. If I am being able to appreciate the glomeruli, the tubules with nucleus in them. See, I am being able to appreciate these things. But here in the affected part, I am being able to see that this is a tubule, this is a tubule, this is a tubule, but I am not being able to see the nucleus of it. That means that architecture of it is preserved, but we are not being able to appreciate any of the cells. So these cells are known as ghost cells. I hope this is clear to you now. So, what is the mechanism by which coagulative necrosis occur? This happens because of the denaturation of the this happens because of the denaturation of the proteins. The necrotic cells are broken down by the action of lysosomal enzymes derived from the infiltrating leukocytes. Inflammatory leukocytes will come and will cause the digestion of the necrotic cells. Second type of the necrosis is the liquefactive necrosis. Liquefactive necrosis is also known as colliquative necrosis. This necrosis is seen in the brain and pancreas. All solid organs show coagulative necrosis except brain and pancreas, and brain and pancreas show us the liquefactive necrosis. The reason behind it, the brain and the pancreas are rich in the hydrolytic enzymes, and these hydrolytic enzymes, there would occur the enzymatic digestion of the dead cells, resulting in the formation of the viscous liquid. So this liquefactive necrosis is seen in the bacterial and fungal infection. The necrotic material is frequently creamy yellow because of the presence of the leukocyte, and this is known as pus. So, how grossly it will present to us? There will be the soft area with a liquefied center containing the necrotic debris. That is, there would occur the soft area, and we will be able to appreciate the necrotic debris also. And how microscopy will appear? That is cystic space with necrotic debris and macrophages. The cyst wall contain proliferating capillaries and inflammatory cells. There will be proliferating capillaries and inflammatory cells. How grossly it will be seen? See, this is the section of the brain, and see, are you being able to appreciate the necrotic area? This is the liquefactive necrosis, and this presenting area is soft. and it contains the necrotic debris in it. Moving on to the further type of the necrosis, that is the caseous necrosis. Caseous necrosis is actually the combination of both coagulative and liquefactive necrosis. But if we see which type is more in it, then coagulative necrosis is more than the liquefactive necrosis. What does caseous mean? Caseous necrosis is actually cheese like. So, it is caused by TB and fungal infection, and which two fungal infection lead to caseous necrosis? That is histoplasmosis and coccidioidomycosis. So, what is granuloma? Granuloma is a structureless collection of the fragmented or the lysed cells and amorphous granular debris enclosed within a distinctive inflammatory bottom. So, what does it mean? That in caseous necrosis, there occurs the granuloma formation, and granuloma is actually the collection of the epithelioid cells. That is, it is actually the collection of fragmented or the lysed cells, and there will be the amorphous granular debris in the center, giving with a distinct inflammatory border, and that inflammatory border is usually made up by the lymphocytes. So, in caseous necrosis, there occurs the granuloma formation. Moving on to the how it will present to us grossly, how we'll see as a caseous necrosis. See, are you being able to appreciate this area? This is actually the lung section grossly. The lung this this is the caseous necrosis. We are being able to appreciate a very dirty necrotic area in the section, in the lung section. So this is actually the caseous necrosis, which is a combination of both coagulative and the liquefactive necrosis. Now further, another type of the necrosis is the um, fat necrosis. So, what is fat necrosis? Fat necrosis is the cell death occurring in the fat rich anatomic locations, and that is the fat rich areas are the breast and the omentum. So, how this happen? I want to explain you here. So, how it happens? See, the breast and omentum. The breast will undergo some trauma. There will happen a traumatic condition to the breast that will cause the release of the fatty acids, and this fatty acid will attract calcium that will lead to the fat sponification, and it will lead to the chalky white deposition in the breast. This is known as fat necrosis. And how in omentum it would happen? In omentum, whenever there happens the release of the pancreatic lipase, this pancreatic lipase will cause the release of fatty acids that will attract the calcium, and there would occur the fat sponification, and that will lead to the chalky white deposition. And how the microscopy will appear to us? The outline of the necrotic fat cells, there would be the basophilic calcium deposition and inflammatory reaction. How it will appear to us, I need to show you. See, are you being able to appreciate here the chalky white depositions? These are actually the fat sponifications. These are the fat sponifications, and this is known as the fat necrosis. Now, moving on to the next type of the necrosis, that is the fibrinoid necrosis. So, what is fibrinoid necrosis? Fibrinoid necrosis is actually the deposition of the antigen antibody complex in the wall of the blood vessels, which results in bright pink or the amorphous appearance of the blood vessels. This is known as fibrinoid. And this fibrinoid necrosis is seen in three conditions, actually four conditions, that is polyarthritis nodosa, systemic lupus erythematosus, SLE, RHD, rheumatic heart disease, and malignant hypertension. All the three words, they are actually a kind of mnemonic, you consider it, that all the three things like PAN, SLE, RHD, HTN, these all lead to the fibrinoid necrosis. How fibrinoid necrosis will appear to us microscopically? See, this is the a pinkish deposition that happen in the wall of the blood vessel. This is how the fibrinoid necrosis will appear to us. So moving on to the last type of the necrosis, that is the gangrene. What is gangrene? Gangrene is more of a clinical term and less of the pathological term. And gangrene is the necrosis of the tissue associated with the superadded putrefaction. That is, it is necrosis plus there happen additional putrefaction of the cells. The necrotizing inflammation is the inflammation provoked by the virulent bacteria, resulting in massive tissue necrosis. So, what are the types of the gangrene? Gangrene are of further types, that is the dry gangrene. Dry gangrene, it is a form of the gangrene occurring due to ischemia and usually in the distal limb. This usually happens because of the ischemia and that too in the distal limb. And there happens a line of demarcation that appears between the viable and the non-viable part, and it is the inflammatory granulation tissue. How microscopy will appear to us? That is, the affected area would be dry, shrunken, and dark black in color, and that too is due to liberation of the hemoglobin from the lysed RBCs, and it consists of the inflammatory granulation tissue, as I told you earlier. So what is dry gangrene? Dry gangrene is actually whenever there happen a blockage or there occurs the non-movement of the blood, that is our cell at the distal limb, they are not being able to get enough oxygen to carry out the normal metabolism. So ischemia happens, and that too in the distal limb, and there occurs a line of demarcation between the viable and the non-viable part, and that line of demarcation is made up of the inflammatory granulation tissue. So, accordingly, microscopy will appear to us, that is, affected area would be dry. Obviously, it would be shrunken because no oxygen is available to it, and it would be dark black because of the liberation of the hemoglobin from the lysed RBCs. And that line of demarcation is by the inflammatory granulation tissue. So, what are examples of it? Like the ischemia of the toe and feet due to severe atherosclerosis, or there occur thromboangiitis obliterans, Raynaud's disease, trauma, ergot poisoning. These all lead to the dry gangrene. Further, another type of gangrene is the wet gangrene. So, what is wet gangrene? Wet gangrene is actually the coagulative necrosis with superadded inflammation, usually in the naturally moist tissues and organs. Like um, in this condition, there is how this happen. In naturally moist tissues and organ, we actually made like our intestine and all. I'll explain you further. So how this wet gangrene happen, that is, there occurs the cut off supply of both arterial and venous part. Both supply will get cut off, and it will lead to the stuffing of the blood. There would occur the stuffing of the blood in the affected part, and it will lead to the rapid growth of the putrefactive bacteria and release of toxin in the blood that will lead to the septicemia. So, I hope you understand this point, that both arterial and venous supply will cut off. And in dry gangrene, what is happening? Only arterial supply was getting cut off, and in wet gangrene, both arterial and venous supply is getting cut off. That will lead to the stuffing of blood. That is stasis of the blood would happen, and it will lead to rapid growth of putrefactive bacteria. These bacteria will release the toxin in the blood and it will lead to the septicemia. And here there is no clear line of demarcation, it is all diffuse. How grossly the wet gangrene will appear to us. The affected part would be soft, it would be swollen, it would be putrid, and it would be dark. And how microscopy will appear, as I told you earlier, it is more of coagulative necrosis plus there is super added inflammation. So, how it will appear to us? There would occur the coagulative necrosis plus intense acute inflammatory exudates and thrombosed vessel we will be able to see in the microscope. So examples of the wet gangrene are the gangrene of the bowel, that is the most common example of the wet gangrene. Diabetic foot is wet gangrene, bed sores are the wet gangrene. So, moving on to the last uh, part of this topic, that what are the differences between the dry gangrene and the wet gangrene? I'll explain you all. See, dry gangrene happens in the distal limbs, and wet gangrene is most common site for the wet gangrene is our intestines. So, how it is formed? What is the mechanism of formation of it? It happened. Dry gangrene happens because of arterial occlusion, and wet gangrene happens because of both arterial and venous occlusion. Grossly dry gangrene will appear as dry, organ will be dry, shrunken, and black. And wet gangrene would be affected part would be moist, soft, swollen, rotten, and dark. Putrefaction is limited because there is stasis of the only arterial supply. So putrefaction would be limited, and in wet gangrene, putrefaction will be marked because there would be the stuffing, there would occur the stasis or the stuffing of the blood, as both arterial and venous occlusion will happen. Line of demarcation will be present in the dry gangrene and it will be absent in the wet gangrene. It will not be clear, or everything would be in a diffuse way. So bacteria will fail to survive in dry gangrene uh, because the blood supply is very limited. And in wet gangrene, it will be present because there is stasis of the blood or the stuffing of blood, and there will occur the rapid proliferation of the putrefactive bacteria, and it will release the toxin into the blood. Prognosis, it has little septicemia, dry gangrene, and profound septicemia will happen in the wet gangrene. Another form of the gangrene is the gas gangrene. Gas gangrene is actually the special form of wet gangrene, and it is caused by the gram positive anaerobic bacteria, that is Clostridia. Do remember this. Do remember this bacteria because this is usually asked as an MCQ answer. So what is actually gas gangrene? That's actually a special form and caused by Clostridia. Grossly, how gas gangrene will appear to us: the affected area would be swollen, it would be edematous, painful, and crepitants would be present. The main thing that distinguishes the gas gangrene from another type of the gangrene is the presence of the crepitants. So, if we are being able to appreciate the crepitants, so we will label it as gas gangrene. The tissue would be dark black and foul smelling. How microscopy will appear to us as a gas gangrene? That the muscle fiber undergo coagulative necrosis with liquefaction, that is there will be both coagulative necrosis and liquefactive necrosis will happen, but the muscle fiber will undergo more of the coagulative necrosis. It is caused by the gram positive bacteria, that is Clostridia, and gram positive bacteria will be seen and in the microscopy. At periphery, the leukocytic infiltration will be there, congestion would be there, edema will be seen, capillaries and venous thrombi is seen. These three things we will be able to appreciate on the microscope. That is coagulative necrosis, gram positive bacteria. Periphery will show us the lymphocytic infiltration, congestion and edema, and capillary and venous thrombi will be seen. So this is the coagulative. This is the gas gangrene. So this is the necrosis I have explained you. If any question related to the necrosis uh, is asked you in the exam, so approach it in this way, so that you get an effective way to tackle with this. So thank you all.